at the beginning, the runners don't know which nurse is ready. So I asked the nurse, what would you do? One of them came forward, says, Lilly, if we can have a green and yellow sign on each of our stations on the screen, I think that will help our runners to see if I'm ready. Because when I'm not with patient, does not mean I'm ready. I'm drawing the vaccines, I'm filling the immunization cards. Does that mean I'm ready? So I'm tired of he keep asking me, so can I just put up a sign? So the traffic control, the traffic light signal helped our team tremendously. Also, they're so encouraged. Oh, we can do the small things to make our day way better. So that's the first very small test of experiment of lean process improvement for the vaccine site.
Hi everyone, I'm Tracy O'Rourke.
And I'm Elizabeth Swan.
And we are from the Just in Time Cafe, and welcome to our podcast. At the cafe, we wrestle with tough questions, we talk to thought leaders, we discuss great books, and get insights from Lean Six Sigma practitioners.
We let you in on helpful apps, we bring you the news, and we challenge the status quo so you can build your problem-solving muscles.
Hey Elizabeth, spring has sprung here at the cafe. What's on today's menu?
Oh man, I am psyched about this. Today's highlight is our interview with Brian Hand and Lilly Angelocci of UC San Diego Health. We're going to grill them about their success with applying lean practices to healthcare and what they learned from their rapid setup of vaccine superstations. We'll let you in on an app that allows you to do real-time polling and other cutting-edge audience engagement techniques. And for Q&A, we'll address the fact that reading a book does not guarantee that you remember anything that you read and what you can do about that. It's a great day at the cafe, Tracy.
Up next, it's hot apps.
This is not a new app, but it's getting newer to me and I'm starting to see its power. How about you?
Absolutely. And with the pandemic in full swing for more than a year now, we have found this is one of the few fun apps. Well, there's actually a lot of fun apps that boost engagement in virtual environments. We're seeing more of them too. And it's called Mentimeter. So informally, it's called Menti. It does some pretty cool things. I was exposed to it during a Women in Lean interchange. So the interchange is a full day event with a series of presentations from women from diverse backgrounds and process improvement experience. And the presentations come in various formats such as gallery walks and lightning talks. And the presenters share tools, concepts, ideas, different apps, and valuable resources. I love the interchange. And during one of the presentations, a colleague used Menti to create a live word cloud. So we watched it morph. They asked us a question, and then we watched it morph and build as people added these descriptive words. And word clouds are also known as Wordle, which I didn't know, or a word collage or a tag cloud. And they're visual representations using words as raw data. So the words used most frequently get displayed larger in size. And guess what else, Elizabeth? There's a profanity filter built in. So you can use word clouds for icebreakers, reflection, or idea generation, and you don't have to worry about the bad words. But there's a lot of other things the Mentimeter can do. What else did you discover about it, Elizabeth?
I discovered it's got a lot of power. It gives you the ability to generate questions. You can assign polls. You can get image feedback. You can create matrices. It's got a lot of options for engagement, which is huge for us, for educators. There's a free version where you get up to two question slides, and then up to 5 quiz slides. There's a basic version for $99 per presenter per month. There's a pro version for $24.99 a month per presenter, where each version adds, a few more bells and whistles. One thing that it had that I'd like to try is called an action priority matrix. And it lets you involve participants in determining what topics to address first, right? If you're working on things, what should we address? What should we go after first? What's the order? Lean author, thought leader Mark Graban used Menti when he did a presentation recently at the Just in Time Cafe, just a few weeks ago, he did an interesting thing with Menti where he had us create before and after word clouds. I had never seen that. He was checking to see the shift in our thinking once he gave us critical info. And I'll include the link to his video so you can see examples of Menti in action. It's kind of cool.
Okay, that sounds great. I think you said the basic version was $99, but I think you meant to say that it's $9.99 per presenter per
If
month.
you're anyone
Just
on a
wanted to
budget,
clarify.
it's much cheaper than $99. It's $9.99 when it's not free.
When it's not free. So we'll include the link so you can check it out.
Thanks, Tracy. I'm Elizabeth Swan, and you're listening to the Just in Time Cafe podcast. In a short while, you'll get to hear our interview with Brian Hand and Lilly Angelocci. You'll hear about Lilly's healthcare experience and Brian's background at the Toyota NUMMI plant and how the transformational healthcare team is influencing UC San Diego Health setup for the vaccination sites in San Diego. Next up, it's a question we pose to our community. How do you remember what you've read? So this is what I've experienced. Even when I read great books, I forget them. People ask me, what'd you like about that book? I'm like, oh, it was great. There's this whole section on education. It's just so good. You know, I end up being incredibly inarticulate about it. And I read a book by Benedict Carey called How We Learn. And he quoted research that was eye-opening for me. He said, highlighting, you know how you take your little yellow pen or whatever to highlight sections you think are important? It does nothing for retention. You have to write things down. And I write things down because I write everything down, but I also was writing book reviews. I wanted to understand what my colleagues were writing. And if I wrote a book review, then I really understood their book, but that takes a lot of time. I don't have time to write book reviews all the time. So I started writing in my books. I put icons like a light bulb that when they gave me an idea and I wanted to do something about it. I put a megaphone to say, here's a quote that I love and I don't want to forget. I put down little boxes with to-do saying, this is sparking my idea or any kind of takeaway. So I just started writing in my books.
I think that's a great best practice. And I have found that I will remember things more from books made of paper, physical books. I seem to have a better affinity of not only reviewing them, but I read more, I retain more. And I've just noticed that the online books, I don't have as much retention. And I think part of it is because I'm always in front of a computer all day. And the last thing I want to do is be on another screen to try to read a book and relax. So it's much better to sit in a hammock and turn those pages.
I know it's kind of showing my age, but I'm just like you. I don't have an affinity for ebooks. I have read them. I've used the comments so I can write in them, but then I have to go find the thing on the computer, unearth my comments. I'd rather be able to just pull it out of my bookshelf and look at what's in there, or as you say, jump in a hammock and relax with it. So yeah, I'm never getting away from the actual book. So I posted that question online because I'm curious, what does everybody else do? This has to be a universal problem. And I heard great antidotes to remembering what you read or antidotes to forgetting. So some people have book clubs to discuss what they get out of the books. Lean thought leader Leslie Henkler of Paycheck, she has people teach chapters within the club. I love that. Karen Ross, the author of Toyota Way to Service Excellence, uses color-coded stickies to capture her learnings. And I liked her description. It looks like very colorful hair sticking out of the top of her books. Mm-hmm. Leadership coach Dorsey Sherman says she writes in all her books, and she also dog ears, and she uses page flaps because she says, quote, ink makes you think. And I love that quote. I think it was from Mark Rosenthal, but I love that. It's really how I live. I write everything down. Japan Lean Study Trip and author Katie Anderson says she uses the Notes app in her phone to capture her thoughts in her latest book, Learning to Lead, Leading to Learn. And she created a separate workbook to drive home the teaching so people can write in the workbook. Now that is a good idea. Mita Sherwood, she does summaries of books. She's a performance improvement coach. I like the idea of just a quick summary. Does it have to be an entire book review? Summary could help. The advice that I plan on using the most came from two different sources. Sunisa Narayanan, Leadership Impact Coach, referenced the Integration Guide by Brene Brown. There's section for quotes, definitions, key learnings. She leaves you room to make your own categories and create your own index in the book to keep track of what you got. Operations exec Eric Lucier also creates his own custom index in the back of the book with page numbers referencing the content, and he learned that from author Tim Sanders. A lot of tips. These were great. I was so happy I asked.
Yeah, a lot of tips. And I'll just share that one of my things is to teach it. So in our classes, when we teach Greenbelt, if I found a book that I read that I love, I will speak to it in class. And there was one book that really moved me and that I used a lot. It was called Switch by the Heath brothers. I ended up creating slides based on some of the concepts they shared. And that, of course, helps solidify learning a great deal if you're teaching it to someone. But I think what's interesting is I haven't taught it in a while. And if I had to rattle off what those key concepts were right now, I think I would have to review my notes.
You're making me want to go back and read Heath brother books. They're so good.
They really are. I'm Tracy O'Rourke. You're listening to the Just in Time Cafe podcast. We host these monthly, so don't forget to subscribe on Apple Podcasts, Spotify, Stitcher, Podbean, or the JIT Cafe YouTube channel where you can watch the video version.
Coming up next, it's our featured guests. Not everyone knows what happens at UC San Diego Health. Tracy, can you fill us in and tell us a little bit more about Brian Hand and Lilly Angelocci?
Absolutely. So Brian Hand and Lilly Angelocci are joining us today. They are both on the Transformational Healthcare Team, or the THT, at UCSD Health. They started on their healthcare journey back in 2017, and they have made some significant progress over the last 3.5 years. We'll get the inside scoop of how they are applying lean and the impact on the vaccine superstations, and how during a time of crisis, the organization leaned in to lean at a time when it would have been easy to put lean on the back burner. Elisabeth and I would like to welcome some people who have made a huge difference in healthcare and in our San Diego community. Lilly Angelocci and Brian Hand of UCSD Health. Welcome to the cafe.
Thank you.
We are so excited to have you both and very excited to introduce you to the world, because I'm a huge fan of what you guys are doing at UCSD Health. And so I would love our audience to know a little bit about you. So Lilly, can you tell the audience a little bit about what you do at UCSD Health and a little bit about your background too?
Okay. Hi, Tracy. Hi, Elisabeth. I am Lilly Angelocci. I'm a leading healthcare coach at UCSD Health. Being here for 8 years, still enjoy every day. I have to say, I love my job. And I've been in healthcare for 15 years. And I think this current coaching role really mingle all of the ingredients I learned together. I am cooking the best dishes I can now to be able to deliver lean, the principle day to day, to bring our people along with ourselves to develop the people, our problem solvers every day. That is my dream come true.
I love it. Thank you, Lilly. I love my job too. How about you, Brian? Can you share a little bit about your background? And of course, I have to insert that you were at NUMMI too, so you have to talk about that.
Yeah, for sure. Love to. So my background started off actually in the auto industry, working for New United Motors, or NUMMI, back in the 90s. And after 26 years, I spent, again, many years in NUMMI, different roles, supporting suppliers throughout North America, with all these lean concepts and developing lean systems to be able to supply parts to us just in time, high quality, at the right price. After that, I served a couple different roles, such as engineering within the plant. And then I got a call to come down to Southern California to work for Pratt & Whitney in aerospace, basically taking my lean skills to Pratt & Whitney, where I served as the site manager for their process improvement for several years. I had a calling, though, to get into healthcare, and an opportunity opened up at UCLA to get into healthcare and apply my skills and knowledge at UCLA. So I spent several years there. Most of it was inpatient, a little bit outpatient, but mainly inpatient, doing all sorts of improvement projects, teaching, training. And then I was recruited up to Sutter Health up in Northern California, where I spent a few more years at ambulatory, and then back on down to Southern California, where I worked for Scripps for many years. And then now most recently, the last 3 years at UC San Diego Health, where I'm also a coach like Lilly in supporting the organization with our transformational activities.
Brian, how did you make that transition? Because obviously, NUMMI, that it's a huge hybrid project with Toyota in the U.S. How did you transition from, Toyota into healthcare? Like what you said, you had a calling. So I'm just curious about that. What helped you make that leap?
So yeah, great question. Thank you. So yeah, for many years, I've always kind of been very interested in healthcare, and always that inquisitive mindset, how things work. When I go to the doctor, I'm one of those patients that the doctor said, "Can you leave now?" A lot of questions there, how things work. But so basically, yeah, I was ready for a change after many years of manufacturing, and however, that transition wasn't easy because I wasn't one of them, healthcare. And back in the day, it was a little more difficult if you weren't a nurse or hadn't grown up in the health system to make that transition. However, at UCLA at the time, one of the leaders, Amir Rubin, the COO, was looking to start a lean team up to create the transformation throughout UCLA. And they're actually looking for folks that were non-healthcare to sort of bring a paradigm shift to the organization and to change things up. And so that's really was my opportunity. Again, that transition into healthcare, once I got that offer and started, again, just going through those, having to prove yourself and having to really understand and spend the time in understanding what is healthcare about, what motivates people that work there, the nurses, the physicians, the surgeons. And at the end of the day, it's all about people and process. And I learned quickly, though, through humility, is to learn from others initially. And then at some point, they start really looking to you for support and help to help transform. But it really starts off with establishing that trust in that relationship in a new environment, not coming in there as the subject matter expert, but really being humble and listening and learning and really what healthcare is all about and what folks do. And then at some point, though, start to transition in teaching them what we do know and start to share and cascade information and knowledge back their way to make their jobs easier and to be able to help them care for their patients in new ways that they have not been able to do in years.
So I also know by working with Brian for a while that he has a really great story when he was younger in his earlier life, that he did have an encounter with a severe accident and ended up in our ICU in UCSD Health.
Oh, well, you have to share that for us, if you don't mind.
Yeah, I don't mind. So back in the right before I started actually working at New United Motors, I was in a fatal car accident and lost a sister. And I think, sometimes those are those pivots in life where you start kind of rethinking what's important. And I think that's always been in the back of my mind is how do I help to change the world in a better way? And so I think that's always in my head, in my mind, and how I approach my work is, again, with humility and understanding at the end of the day, what's really important, right? It's not to perhaps push out one more item or to get something done, but it's how we do it. And to be able to share my experiences and to be able to help every person that I encounter to fulfill their purpose in life. And that's really what I think drives me in everything I do.
That's an incredible cycle, to have that pivotal moment happen and involve UC San Diego Health, and then your own journey taking you now back as you sort of bring that goal to fruition, what you wanted to do, what you felt compelled to do by that moment in time. That's a really moving story. And thank you for that.
You're
Yes,
welcome.
thank you. Listening to you talk, I had a similar experience. That's actually what prompted me to move into process improvement as well. My mother died at a very young age, unexpectedly, and I was just starting my process improvement career and decided life is too short, and I didn't want to spend any time doing something I really wasn't passionate about. And so she led me to the path, really, of process improvement. So I'm familiar, it's a very different and personal situations for all of us, but I'm familiar with finding your passion, and I can really appreciate that. So thank you.
You're welcome.
So I would love to hear about your journey so far on the THT team with Ashley Gambier leading the way. So I've known Lilly for about 6 years. I was speaking with Ashley when she first was tasked to come to UCSD Health and start the transformation healthcare team. What were you tasked to do, and how is it going so far?
Just a quick note, Tracy, can you spell out what THT stands for?
Yes, Transformation Healthcare Team is what THT stands for.
Thank you.
So tell us, how did THT, the Transformation Healthcare Team, were they set out to do? What were they tasked to do at UCSD Health?
Perfect. If I could, Lily, I'll go ahead and start it up, and I would love for you to kind of add to and take us kind of to where we are today. But I've been with the group 3 years now, a little over 3 years, and Ashley Gambier was really the founder of THT. Back in like 2017, she had been asked by our COO and other executives to help to start up a lean team. And this is really through her ambition to improve processes and to connect with people. And so one of the first things back in like 2018, when she had been there for some time, leading some projects and doing some improvement work, is started forming a team and bringing basically folks from inside that had an interest in improvement, as well as folks like myself and a few others from outside of UC San Diego Health, to really create a team that could help to deliver the mission. And the mission that really centers us is to develop 10,000 plus problem solvers in the organization. And so it really started off with assembling of a team. And really the first year, THT spent quite a bit of time initially developing the infrastructure. We had nothing, but many people came from different backgrounds or different places throughout UC San Diego Health with different experiences. And one of our first challenges really was to create the one way, the methodologies that we felt that we should anchor our process improvement methodologies around, again, with backgrounds from Stanford, from NUMMI, from UC San Diego Health and other areas, is how do we create that one way that we anchor around? And so that was really the first year, is developing standard work for running RPIWs, developing training materials. And we do have currently a Lean Six Sigma belting process that we developed from scratch, and just it's been, again, evolving. And I know you, Tracy, have been a big part of that, as well as the daily engagement system. We started off also calling it MDI, and then DMS, or daily management system, and just even some key terms like calling it daily engagement. People felt much more comfortable that it wasn't so much of a management, but it was an engagement system. So really developing that and deploying it, so every level in the organization feels connected and centered around improvement and aligned to our priorities. And as I mentioned also, was really the development of training materials, so people not only knew what to do, but how to do it. And so I'll let Lily speak briefly about our training program, which she heads up, and how many we currently train per year.
So we have a really broad range of training programs to customize to our really busy clinicians, doctors, nurses, and all the front lines supporting administrative staff. So ranging from 2 hours, white belts, to all the way, we have a WLP workshop leader program that Brian is leading, that will take a leader perhaps up to 18 months to complete that journey to become a RPIW workshop leader, the true lean leader with a mindset. So we put through about 600 to 800 belted colleagues each year. which is a really ambitious goal. We could not even imagine that 2 years ago, even a year ago. So our maturity has been developed really quickly from, like Brian said, with nothing, no teaching materials till now. We create everything customized to UC San Diego Health specific customers, specific colleagues, and our own conditions. So again, our mission and vision, as Brian said, we always focus on people, and our patients define value. Whatever we do is to how do we efficiently, best way to deliver that value to our patients safely.
Lilly, just for clarification, remind me of what that acronym means. Is it RPIW?
Oh, Rapid Process Improvement Workshop.
Workshop. Oh, okay. It's funny. We all have our own versions. Like there's we have Rapid Improvement Event. So yeah, I just actually wrote a article about just acronyms and how it's our own private languages and we have to share them and decode them for each other.
It's a very, very good question, Elisabeth. So it's all branched out, I believe, from my little shallow study learning journey here is all branched from the word, Japanese or Chinese words, Kaizen, the change for better. So it doesn't matter what the size of the workshop. It could be 2 hour. Brian and I can just go to the site and deliver in a OR room to our doctors. Why we don't have to print out the patient information right after the surgery in that OR room? How do we connect the dots and then fix that problem on site? The 2 hour consulting work to all the way, like I said, the workshop leader program that takes 18 months to complete for a qualified graduate. So the sizes are different, but it all doesn't matter the name, RIEs, Kaizens, RPIWs, it's all branched around this continuous improvement concept.
Fantastic. And thank you for laying that out, Lilly. That's awesome. And what kinds of successes, you said a bunch of intriguing things about where all these Kaizens or these rapid improvement events were happening. What kinds of successes did the transformational health team have? Or can you give us some examples?
Sure, I'll start. My first encounter actually kind of helped me settle my foundation learning journey here. First month when I joined THT, I got to shadow or bring an apprentice of Brian's workshop. At the time, it's RPW 10. Now we're at 20 now, so it's halfway journey. The problem we tried to solve was a lengthy wait time for our referral process. Once patients have the desire to be treated in our system till we actually make the first appointment for them, average was about 35 days. And think about this, I have a severe disease, I'm not feeling well, and I want to get into our system, and I have to wait for 35 days for an appointment. And it's average, sometimes can be longer than that. So Brian has led the team to tackle about 40 people, sit in the room, in and out, on the Zoom, for a whole week. Let's look at this system, where are some of the gaps are. So my transition from operations, the firefighting mode, let's just get through the day, be the hero. Let's not to get to the root. I don't have time for that. Sitting through that week completely converted me to, wow, this works. Lean actually works. When we have the patient slow down, take a pause, have all the right people together, even in the same room, to go through the process instead of people blaming. It's really easy. Go through the silo to really pinpoint, put our fingers and feel that where that problem is. End of that rainbow, like our chief surgeon always say, Dr. McHale, his famous quote, end of that rainbow, there's pot of gold. That is our patient. That is our purpose. How do we deliver that gold to that patient? It's our day-to-day mission. So I think that first really early learning experience from the true lean leader and mindset helped me a lot to transition from an operational firefighter hero type to this lean, follow the principle, follow the mindset, engage people, develop people too. By the end of the day, it's the people make that difference.
Wonderful. Thank you for sharing. I want to shift gears a little bit and talk about COVID. It's been a year at least. And what was really interesting about COVID is, being in the process improvement industry, I experienced many people saying, oh, we have to stop what we're doing. We can't focus on process improvement anymore because we have to do this other work. And that broke my heart because I was like, wait, what do you mean you're putting it aside? Isn't this when you're supposed to lean in with process improvement? And you guys are a shining example of not saying, oh, we don't have time for this, especially in healthcare. So tell me a little bit about how that worked for you. How did you lean in to Lean and Six Sigma process improvement, or just process improvement with COVID? Tell us a little bit about how that happened. And I would love to hear about how you applied this to the vaccination stations as well.
Yeah, so maybe I could just kind of tee it up, and I would love, for Lilly to share, because she spent a tremendous amount of time also in helping stand up and work with our operational leaders and frontline staff to develop some amazing processes. But kind of back a year ago, the mindset was really command centers, because it was a crisis at the time, as Lilly had shared, with patients coming from Wuhan, China, into our system. And again, we activated our incident command centers, and just like we would with some other kind of big emergencies. And I noticed we were very reactive. But again, this is what we had done in the past. And as we looked around and seeing people work long hours, all trying to do the right things, we started noticing opportunities to apply many of these lean principles and concepts to be able to really create stability, calmness, and control of processes. And I think that was one of the first things, again, just looking around a room of a command center where people are running around with many different colored vests and radios and telephones, and we seen that, hey, this is a perfect opportunity to implement our daily engagement system. That was one of our first aha moments. And so we had clarity around what were the priorities of the day? How do we use visual management to signal what are the priorities? Who's working on what? How do we have daily huddles to basically give updates to understand the status of the work? How are we aligning to the priorities of the organization? Whether it's patient census, quality, safety, supplies, even masks. Looking back, there was the big concern around supplies as we look at readiness for the day. Do we have supplies and PPE for our patients? So again, I think that early stage was really is how do we utilize what we know works for this crisis right at the point at that time. And so from that, it really led into how do we start now to redefining processes that had been set in place for many, many years that perhaps wasn't as effective or efficient now with the pandemic. And one example of that would be, for example, our traditional seeing patients in clinics. As we all know, that the social distancing and the concerns around transmission of this virus was real. And one of the things that we began to do was to form teams. And again, I know Lilly just talked about Kaizens or rapid process improvement workshops. Well, we use that same methodology with our leaders that had been through our training programs and learned quickly that we have to rethink our processes. How do we care for our patients using perhaps new methodologies or processes? And so this was things such as telehealth. It being in an academic medical center, a teaching hospital, that's something that we really had done very little of. But how do we put that in motion? And literally within weeks, with a week to 2 weeks, we're able to see about 80% of our patients with new methods that we hadn't done in 50 years using our lean methodologies and having new breakthrough ideas. That really led into how we began to do our COVID testing, which was a big part, understanding, are we safe? And one of the requirements was to have our COVID testing for all employees. But I'll let Lilly perhaps talk about how we transition in using lean methodologies to set up some of our testing facilities, such as the ECOB facility. Lilly, could you kind of share about that?
Yeah, so that's the beginning of our journey for vaccinations, right? So it's a big celebration as human being. We finally find a cure or at least layer of protection toward this fierce virus that we're still studying every day based on the nationwide data. So the ECOP, we set up a conference room. How do we deliver this vaccine? This is a really good example, small work cell flow example of laying that how we flow the patients through efficiently, still keep the social distance, have the pace, the flow for our 11 or 8 to 11 workstations for our nurses to be able to smoothly manage. So smooth out the workflow by starting with appointment slot time, 15 minutes every 6 patients every 15 minutes from 6 in the morning till the close time, 5 o'clock in the afternoon. So I think first of all, our principle of respect of people and deliver the value to our customers. That's always kept on our mind as a Lilly team. We go in, the flow is easy, right? Every clinic have a flow. We can just copy and paste the medical doctor's flow from check-in to check-out. And there's caveats though. We do have to build in the 15 to 30 minutes observation time. And no other clinic need to do that. Usually you get your appointment, you leave. So a lot of engagement at the beginning, we bring in, we gave the power, we share the power as a Lilly team, we step in and we ask our nurses, you are the expert. What is your ideal time, ideal way to deliver this shot? Simply put, it's a vaccine, it's a shot to our patients. So they started to realize, well, we have the decision power. We can design the flow together with this Lilly team. And so I think that's to create that safe environment for them to open up, to really empower themselves. Lilly, let me tell you, I would label this medical supply drawer this way. Okay, I said, great, do that. And every morning huddle, midday huddle, and end of day huddle, we do reflection. It's so important for the team to come together to learn, because remind our audience here is these nurses are flow team or IA contract nurses. They flew in, it's Christmas time, they flew in, they are away from their family. They're here to serve our patients for a bigger cause to stop the pandemic. So we ask them daily, what do you need? What is that one thing that you will need to make your day better? And sometimes it's simply a cup of coffee because they couldn't get enough sleep. It's long hour days and they don't know where the Starbucks is. So sometimes just go out of the way to bring a cup of coffee for them. And then it changes the whole dynamic of the room. So Lilly has been in and out of the small ECOP, our first small clinic. We deliver about 3 to 400 vaccines per day. It's not a big production. But we learned so much from that clinic, from engaging people, develop people, problem-solving skills, show them how to use a very basic visual management. For example, at the beginning, the runners don't know which nurse is ready. So I asked the nurse, what would you do? One of them came forward, says, Lilly, if we can have a green and yellow sign on each of our stations on the screen, I think that will help our runners to see if I'm ready. Because when I'm not with patient, does not mean I'm ready. I'm drawing the vaccines, I'm filling the immunization cards. Does that mean I'm ready? So I'm tired of he keep asking me, so can I just put up a sign? So the traffic control, the traffic light signal helped our team tremendously. Also, they're so encouraged. Oh, we can do the small things to make our day way better. So that's the first very small test of experiment of Lilly process improvement for the vaccine site.
Lilly, that's such a you just gave great examples of fundamentals and respect for people. I especially love the reflection piece and really keeping a cycle of learning. You obviously made it very clear that people were allowed and encouraged to give input. And once they saw that, I'm sure that accelerated, but you clearly it's the little things that made the big differences. And that's just exciting. That must have been a very exciting thing to be a part of.
Very rewarding. By the end of the 14-hour days, we were recharged, we were energized. As a team, we celebrate every day. We have a flip chart set up. We celebrate what went well, and we hand off to next morning's team. What have we learned of the day?
Mm-hmm. Well, we're to a close about how much time we have at the Just in Time Cafe with our friends here. But I do have to ask one last question. Well, and tell maybe a little short story. So what's really funny is Lilly is so wonderful. I reached out to her and I asked her if she could give me a tour of the Petco Superstation. She met me on her Saturday. And of course, I posted the pictures. I was so grateful that she was able to spend that time with me. And of course, Mark Graben says, I want to go. And so then we said, okay, let's go to REMAC and let's go see what they're doing over there. And so Mark and I were able to meet Lilly and Brian and the rest of the team over at REMAC to see what you guys were doing over there. And I can't end this interview without asking you at least how a little bit about REMAC and what you did to get that set up in 1 week's notice, number one, and what were some of the things that you incorporated into the REMAC facility that related to lean concepts. So can we just spend a little time on that? Would that be okay?
For sure. And so, yeah, that's a great question. So yes, the bottom line was we had to stand up a super site to vaccinate our patients in a very short amount of time, a week. And one of the things that we did initially to help us to be able to achieve that is we did a quick pause and looked all around us. Over the past year, there have been many COVID-related processes stood up to either test or vaccinate patients that we wanted to better understand what if we had to do it over, if we could make some changes. What would that be, and what did we learn? Again, this is the hindsight, or the reflections from the past. It would be, what did we learn? What do we want to keep doing, and what would we have changed? And so, as Lilly had shared, we had the ECOB, which was the employee vaccination centers. We had multiple drive-up locations for testing throughout our community that we had set up using lean principles. We had walk-up testing. We had a Petco, which is basically the Padres baseball large facility or parking lot where we had set up now for vaccinations of our community. And so what we did is looked around, and we quickly realized that many of these principles would directly work to stand up the REMAC, which is on our UC San Diego campus. But the difference is it would be a walk-in clinic for vaccinating our patients. And so again, with that, there was searches throughout our community to find a location. We did find the location. And one of the things we did is I'm going to use the term a 3P. So Ashley Gambier basically pulled together the lean team, had already talked to some of the operational leaders around what are the volumes that are required, days of, hours per week, et cetera. We had all the data we needed to understand what problem we needed to really solve. And then so we modeled out, instead of 13 ways, we didn't have time, but we did like our 3 ways and how we could achieve these goals of vaccinating upwards of 5,000 patients per day in less than a week. And again, with that background of understanding what we had done in the past, other examples, we put together different models. We modeled out different flows, different layouts, and we really came to a couple conclusions. Number one, that perhaps we weren't willing to take a risk to do something too breakthrough, and so we sort of compromised. We came up with a hybrid model, which is called the pit stop model. And again, this pit stop model relies solely really on being able to collect the necessary information in our EHR at one table with a clinical vaccinator who's simultaneously being able to deliver the vaccine. And so that model really came about through experimentation over a year and how best to do that. And some of the technology that we used is now like a handheld rover, where we're able to basically scan a QR code and bring up patient information immediately into their patient records and be able to scan in the vaccination with a lot, the date of thaw. And again, this was a big breakthrough. If you look back 3 months prior to, we had computers, those big WOW stations, And very much it relied on a lot of keystrokes. And over the past 3 months, we're able to put together some process that can flow upwards of 5,000 people very efficiently using technology. And most importantly, as Lilly had shared nicely, was the culture at REMAC is very much centered around the people. And that's really building that environment of trust and safety, that everybody feels safe to bring forward ideas and is empowered to help support and deliver that vaccination, because we have one purpose, and that's, again, to save lives and to basically put vaccine in arms. And so, Lilly, would you like to share a little bit more about that?
Sure. Yeah, that's amazing that from zero at REMAC, we built it from scratch, right? And by the end of third or fourth week, we had 30,000 volunteers sign up to support the site. It's tremendous energy support from our community. And these are long hours, days, without any reimbursement. All there is a pat on the shoulder, good job. And if you ask our volunteers and their experience, that is that, patients come to me, tell me how well organized the site is, tell me how grateful they are to have the vaccine as early as they can get. To tell us the flow goes really well. It only takes them minimum about 15 to 30 minutes to go through the whole process. They'll share with you, this is what keep coming back to support our site. And come back to the point of the learning of the process-wide, that from REMAC, I would probably pivot a little bit here, is to we as Lean team as well, we continue to improve that the process time, the touch time at our nursing station where the patient value is delivered. However, sometimes when we get together, when we look at the value add versus non-value added general, 90%, 10% proportion, right? 10% that value added time, that's we touch patients' time. We constantly improve that every day. We have come up team as new ideas. And then we step back. How about that 90% of the non-value added time, right? The process, like Brian says, we improve the rover. So it saves time for patients to wait in line, the long line, from day prior, try to log into the website to try to get an appointment. And then the highway traffic. All of this was contributed to that 90%, that non-value add patient care, right? So our team has shifted a lot of energy try to solve the problem upstream, starting of the journey when the patient started to spend their late night hours trying to get appointment online. A lot of involvement, a lot of technology happened, and all geared toward that purpose of our value is to deliver that vaccine to our patients, to stop this pandemic. Yes, that kind of goes.
Well, again, I thank you. We want to thank you for coming to the cafe and sharing a little, giving the audience a little insight about what you're doing, the great things you're doing to impact healthcare, the way you've implemented process improvement into a crisis. Thank you so much. I wish I could spend another hour with you and get another mocha latte, but unfortunately we can't. We're out of time now, but I look forward to hearing from you more again in the future. So again, thank you so much for coming today.
Great to meet you, Lilly and Brian. Thank you so much.
Thank you. Thank you again. It's been a pleasure being here today.
My pleasure. Always nice chatting with you ladies. Thank you so much for having us.
Don't forget to register for our May 6th webinar with Jim Athon, where he'll expand on different ways of mapping processes, color coding, creating deployment or swim lane maps with timelines, IT system flows, Gantt charts, spaghetti maps. He's a map king and he's an awesome teacher. It's going to be a great webinar. Please register. Also sign up for our May 20th webinar with Brian Elms of the Change and Innovation Agency, with Sabrina McLeod from Port St. Lucie, Florida. Hear about how they've applied process improvement concepts to benefit the city.
And tune in for next month's podcast episode where we interview Debbie Barnard, a global healthcare executive with over 20 years of experience in the areas of strategic deployment and prioritizing quality as a core business strategy. She'll be joining us from Dubai, where she's on assignment as a consultant for the Joint Commission International.
If you're looking for training on how to become a better leader, register for our Lean Six Sigma Leader course at UC San Diego, which starts June 1. Stay tuned for all the news by joining our community at the JIT Cafe. That's JITCAFE.com.
And if you want to improve your problem-solving skills, listening skills, and your ability to react better in the moment, come join Elisabeth's June 16th improv workshop, In the Moment, How to Apply Improv to Lean Problem Solving. I participated in the first workshop, and trust me, you've never been to a training like this. The point is not about being funny, but it is fun, and people were funny. So Elisabeth does a great job of weaving improv concepts with problem-solving skills. You do not want to miss this. We'll include the link so you can register right away.
Sign up. It's awesome. We just ran another one yesterday and it rocked.
It did. We're happy it's finally spring, and we're thrilled that you've joined us. The Just in Time Cafe is so much better with all of you.
It sure is. And we hope you enjoyed your dose of lean caffeine.